my name is Lauren Crabtree and I'm here to do my video assessment. Here's my patient Janet. Hi Janet, how are you doing today?
Doing alright.
Doing alright. Hygiene real quick. So first I'm just going to assess her skin just from looking at her. It looks like she has pretty clean, dry skin. I see a couple freckles. Capillary refill's good. Dry. No noticeable odors or hygiene issues. There's one tattoo on her forearm. Warm and dry on this side. Cap refill's good also. Looking at her face, there's no open wounds or lesions or sores that are noted. Have you had any problems with rashes that you've noticed in the last few days?
No.
Okay, I'm gonna just look at your leg real quick. Any, well, those are clean, dry down there, so that looks good. There's also another tattoo down here. Okay, just gonna take a closer look at her head. Looking at it, looks symmetrical. Looks good. Skin also still looks really good on the face, and palpate her head for any noticeable malformations, that tender anywhere. Okay.
Nope.
And I'm also going to check her sinuses, any pressure, anything, tenderness.
Nope.
Any tenderness with that.
Nope.
I'm also going to check her TMJ and just, does that hurt at all? Okay.
No.
Smooth. I'm also going to check for her temporal arteries, and those are good also. Alright, so for this portion, I'm going to assess her eyes. I'm just going to have you take your glasses off for me real quick. I'm going to shine a bright light in your eyes. Just look straight at me. I'm going to check for perla. Again. This eye. That's good. Perla's good, equal and reactive in both eyes. Now I'm just going to have you stare at my pen light and then follow my pen light with your eyes, checking her cranial nerves. And those are all intact. And then now I'm just going to pull down on her eyelid, check the conjunctiva, and it looks good. And then her sclera is also white. Any problems with drainage or runniness or anything? Alright. And then now I'm going to check your peripheral vision, so I'm going to get real close to you, and then you just tell me when you can see my fingers move.
No.
I was going to do it again.
No.
Alright. So that's good. And then now I would also assess her vision, so I would use the Snellen chart. I would have her stand 20 feet away from the Snellen chart, have her read the lowest line that she could read, and then that number would be what her vision would be. Alright, so for this portion I'm going to take a closer look at her nose, her mouth, and her ears. So first I'm just going to inspect her ears. I notice they're symmetrical on both sides, about the same length. They look clean and dry, any problems with drainage or anything. So first I'm just going to inspect them, so I'm going to pull back and up on her ear. I'm looking through it now. Those look good, and I'm going to do that same thing on this side. That's good also. And then now I'm going to perform the whisper test. I'm going to cover one ear and then whisper.
Apple.
And the same thing on this side.
Apple.
Good job. So next I'm going to inspect her nose. And then just pull up on the top of your nose and look into her nose. No drainage or anything wrong with the nose. Nose looks good. There's no drainage or dry boogers, nothing there. Alright, so next I'm going to have you open your mouth. I'm going to inspect your mouth. Can you say ah for me? Stick out your tongue. Alright. There's no open wounds, sores, or lesions. Mouth looks pink, moist. It looks good. Alright, for this portion I'm going to take a closer look at her neck, and I'm going to notice that it's symmetrical. Take a look at her trachea, it's midline. I'm going to check her thyroid. Don't notice any nodules or anything, so then I'm going to check for her lymph nodes. Any tenderness, soreness with that?
Nope.
Any soreness, tenderness? I'm going to palpate these.
Nope.
I'm going to also check her carotid pulse. And it's good on that side. Check one more time. And it's good on that side. Alright, so for this section I'm going to take a closer look at her chest cavity and her lungs and her heart. So just looking at it, the chest wall looks symmetrical. I'm just going to palpate for any nodules or lesions. Is that tender anywhere that you're noticing? I was going to assess the back at the same time.
No.
No noticeable palpations. From looking, I don't see any open wounds or lesions. And then I'm going to also take a listen with my stethoscope. And each time that I move my stethoscope, just take a deep breath for me, okay? Deep breath in and out. Anteriorly, the breath sounds are clear bilaterally. Don't hear any wheezes or any crackles noted. I'm also going to do the same thing to her back lungs here. Big deep breath for me. Okay, and then for the next part, I'm going to have her whisper for me. I'm just going to have you whisper the number 99, okay?
Okay.
And I did not hear anything. So lung sounds on posteriorly are clear bilaterally, no wheezes or crackles noted. And now, next I'm going to take a listen to her heart sounds. First I'm going to listen for the aortic valve. And next I'm going to listen for the pulmonic valve. And then the tricuspid valve. And then the mitral valve. Heart tones are normal, regular rhythm, no murmur noted. That's it.